Good afternoon, everybody. My name is Carl. I'm a recovery coach here at Capital Recovery Center, and this is our meeting for the day. And the article I have here is Consequences of Drug Abuse, Physical, Mental, and Emotional Effects. So we'll hop right into it. It says physical consequences. Drug abuse can have serious physical consequences that can be both immediate and long lasting. The physical effects of drug abuse depend on the type of drug you use, the quantity, and the frequent of use. Some of the immediate physical effects of drug abuse can include heart attack, stroke, respiratory failure, seizures, and coma. And some of the long-term drug abuse can damage the body in many ways, including liver damage, kidney damage, brain damage, respiratory problems, cardiovascular disease, and cancer. So we talk about how drug abuse affects the mental, the physical, and the emotional, and it touches on all of that. And some of the things that for the physical aspect, and this, if it talks about determining how long you use drugs, what kind of drugs you used, the frequent, how much you use every day, every other day. So you can experience, heart attack, stroke, and many other physical effects that can really harm you and eventually kill you. When I got in recovery, I wanted to worry about my health because I didn't take care of my health for the longest. For many, many years, I wasn't going to the doctors. I wasn't getting checkups. I wasn't getting blood work. Um, I was doing and eating whatever, and just I wasn't worried about my well-being. And so, like when I got in recovery, I see a doctor every few months. I get regular checkups. I get blood work done, and so I found out like I had Hep C because I used to be an IV user, right? So I took care of that, because if I prolonged it, you never know how much that could, gave me some liver damage, So like thank God I went and got checked up and got some blood work done, and I took care of it. I'm trustworthy and reliable and accountable, and so I had to, do the proper things to better my health. So let's see what the mental consequences. It says drug abuse can also have serious mental consequences. The effects of drug on the brain can be long lasting and can lead to various mental health issues, including depression, anxiety, paranoia, psychosis, schizophrenia. Drug abuse can also have an impact on memory, attention, and decision making abilities. This can make it difficult to function in everyday life and can lead to problems at work, school, and relationships. And so we're talking about the mental consequences. So I know from experience, like you really don't really to like find out until like later in life, um, we develop, depression and anxiety and stuff like that. But like sometimes that happens before we start picking up the drugs and alcohol, right? But sometimes, while we use drugs and alcohol, we can experience and develop depression, anxiety, schizophrenia. It can definitely add to our mental health, and we can develop a lot of mental health during addiction. And sometimes like medications needed, because like if we treat our drug and alcohol abuse, we have to also treat our mental health. So like sometimes in some cases, like mental medications are needed, and I've seen people like um, lose their mental state because of drugs and alcohol. Like you don't come back from that. Like certain drugs that you do really put a damper on your mental state, and like sometimes I've seen people like never come back from that, like they're permanently mentally damaged from using drugs and alcohol. So we don't think about that when we're in like active addiction. We're just thinking about using and thinking we're going to get high, and like we're not worried about the consequences, you know, in the moment, you know, until like things happen, then we're like, oh, you know, let's deal with the consequences then. But like, let's just keep using drugs and alcohol, and like let's ride this out until like the consequences get bad enough. It says the emotional consequences. Drug abuse can also have serious emotional consequences that can be just as damaging as the physical effects. Substance abuse can lead to feelings of isolation, loneliness, and shame. It can also damage relationships and lead to a loss of trust among friends and family members. The emotional effects of drug abuse can be long lasting and can impact your ability to form healthy relationships in the future. In addition to the negative emotional effects, drug abuse can also lead to mental health problems such as anxiety, depression. These conditions can, the cycle of substance abuse lead to downward spiral of deteriorating mental and physical health. It's important to remember that drug addiction is a disease, not a personal failing or a moral weakness. Seeking help for substance abuse is a brave and important step towards recovery. There are many resources available, including support groups, therapy, medically assisted treatment. Yeah, it's a definitely, it talks about emotional. I was very emotional in active addiction. You know, I was really sensitive, you know, like, I was just talking about this the other day, like, my highs were my highs and my lows were my lows. There was no like even keel. Like it was if I was up, I was up. If I was down, I was down. So like I wasn't like emotional regulated, you know, like it was just always up and down, and I never had like a even common ground in my an emotional state, you know. So it's like um to come in recovery and to like balance out, you know, to like even out my emotional state. You know, and it takes time. It's a process and it takes work. Um, because when you're clouded with drugs and alcohol for many years, our emotional state is just not, it's not good. You know, so it takes work, and it takes, and talks about like therapy and medically assisted treatment, support groups. So there's various resources that are available to today that that we used to have back in the day. Like it definitely grew bigger with the resources. Thank God for that, because we need a lot of resources. We need a lot of help. You know, it's just like we have to find out what works for you to like stabilize your life and your recovery. It says the impact on the brain and cognitive function. Drug abuse can have a significant impact on the brain, leading to long-lasting cognitive impairments. Different types of drugs affect different areas of the brain, interfering with normal communication between numerous stimulants like cocaine and methamphetamine increase dopamine levels in the brain, causing arrhythmia and heightened arousal. However, prolonged use of these drugs can damage dopamine receptors, leading to reduced pleasure response and depression. It says opioids like heroin and prescription painkillers bind to opiate receptors to the brain, reducing pain and inducing feelings of relaxation. However, chronic use of opiates can lead to changes in the brain chemistry that results in physical dependence and withdrawal symptoms. Opiate abuse can also interfere with your normal breathing patterns, leading to oxygen deprivation that can cause permanent brain damage. Marijuana use also has also been linked to changes in cognitive function, particularly among adolescents whose brains are still developing. Studies have shown that regular marijuana use can impair memory and attention, making it harder to learn new information and perform complex tasks. In addition to these specific effects on different types of drug substance abuse, is general can also lead to structural changes in the brain that affect cognitive function. Chronic drug use has been associated with reduced gray matter volume in areas responsible for decision making, emotion regulation, and memory consideration. That was a weird word. It's important to recognize that addiction is a chronic disease that affects both the body and mind. Seeking treatment for drug abuse is essential, not only for physical health, but also for cognitive function and overall quality of life. Recovery is possible with the right support and resources. And it talks about the cognitive, right? The impact on the brain, the cognitive functions. So, like, and it talks about using at a young age, right? And that was me. I use at a young age, and it says that your brain is still developing. At a young age, we're still growing and we're developing mentally. And when we start using drugs at a young age, it stops the process of learning and growing and changing. It stops your growth. It really does, mentally, physically, and spiritually. So I didn't really take a hold of that when I was young. I thought I was just like having fun. I was just partying, and it was at one time, right? Until it became not so fun. Until a lot of consequences started coming in that, like we're talking about, they started getting worse and worse and worse, and I started getting worse and worse. And we don't know how bad it can really affect us until later in life. So like I said earlier, like I know some people that are not mentally not coming back, and experience physical health that like diabetes and liver damage and stuff like that. Like I can't think I'm going to use drugs and alcohol for many, many years and not suffer from consequences. Consequences are always there. It's just they're different for everyone. So like for me, like a lot of my consequences were like jails, institutions, and I was 32 arrests and like many overdoses and almost died. So like there's consequences for everyone. For everyone there is consequences to our actions. So we can't escape that. So it's like I'm very blessed and very grateful for the mental state and the health I do have today. I'm very grateful that I have all my limbs. So like I got to be grateful for what I do have, because a lot of people don't have that. And it's sad to say, man. Like we can get clean and sober, right, and like experience things in life from active addiction. The consequences. And so we got to be careful what we do in life today. It says causes of drug abuse and addiction. So drug abuse and addiction can be caused by a variety of factors, including genetics, environment, and personal circumstances. Some individuals may be more susceptible to drug abuse due to their family history of addiction or mental illness. Others may turn to drugs as a way to cope with stress, trauma, or other emotional issues. Wow. Environmental factors such as peer pressure, availability of drugs, and societal norms can also play a role in the development of drug abuse and addiction. For example, living in an area with high rates of drug use or being surrounded by friends who use drugs can increase the likelihood of developing a substance use disorder. Now, it's a little bit of my case. I was a product of my environment. Personal circumstances such as poverty, unemployment, and lack of social support can also contribute to drug abuse and addiction. Individuals who experience these challenges may turn to drugs as a way to escape their problems or cope with their difficult circumstances. It's important to understand that drug abuse and addiction are complex issues that cannot be attributed by any single causes. Effective treatment must address the individual's unique circumstances and underlying issues that may have contributed to their substance use disorder. Yeah, so it talks about a little bit of your, if it passed down by genetics or environment, peer pressure. So like that, I played a part in a lot of my drug addiction. So we in recovery we learn about those things. And like the kids I was hanging around with, were using drugs and alcohol, right? So a lot of my friends were. So I end up using, so in like, and it talks about genetics. I like with that, me personally, like people say yeah, and some people say no. There's always a controversy about that. But like I think it was like a lot of how you're brought up, not just for drugs and alcohol, but like for a lot of things. If you stick around troublemakers, usually you can become a troublemaker. So it's like I was definitely a product of my environment, and it says about peer pressure that can be a factor in others. I was really not like peer pressured, but it was around me and the kids asked me, so like I just was a follower, not a leader kind of deal. So it was easy to get me to do something. Um, but yeah, it talks about personal circumstances and like things happen in life, man. And people can use drugs to cope and to avoid reality. Which is just unhealthy. There's other ways that we can cope and to deal with our problems today. And talking about like escape difficulty circumstances and stuff like that. So it's different for everybody. It's different for everybody. A lot of people use drugs and alcohol. And then we talk about the solution in recovery is like we find out what the root and the core is of me using drugs and alcohol, right? So like as we're doing right now, like I see that I was a product of my environment, right? I wanted to like party and have fun that I thought, I was just trying to fit in and like I didn't want to deal with reality, like going to school or doing this or doing that. I wanted to do what I wanted to do. I was very self-centered and self-willed. I was always out on my own and doing what I wanted to do. I wasn't willing to listen. So like I wasn't respectful, I wasn't trustworthy. So I was just doing the totally opposite that what recovery teaches us, and just I was out of my mind. Let's see here. It says how to identify substance abuse. Identifying substance abuse in someone can be difficult, but there are some signs to look out for. If you are concerned that someone you know may be struggling with drug abuse or addiction, here are some things to watch for. Changes in behavior or attitude, withdrawal from friends and family, loss of interest in activities they once enjoyed, neglecting responsibilities at work, school, or home, financial problems or unexplained expenses, mood swings or erratic behavior, secretive behavior or lying about activities and whereabouts. Yeah, so see, some of these are the signs that to look out for in somebody if I think they're struggling with drug and alcohol. And you got to be careful. We have to be careful how we talk to somebody about it. Because a lot of times when somebody's probably struggling with drug and alcohol, we can get frustrated, we get angry, and we can say some not so nice things. So we have to be loving and caring and supportive, and we have to watch what we say and how we say things to help to try to help somebody. It says it's important to approach the individual with compassion and understanding. Substance abuse is a complex issue that often involves underlying emotional or mental health issues. Encouraging them to seek help and offering support can make a significant difference in a recovery journey. Remember, recovery is possible and there is always hope. And another good way is to like have a better understanding of a drug and alcohol addiction. If you really love somebody, care for somebody, and trying to help them, to like have a better understanding about drug and alcohol addiction. So how to get them the proper help that they need. Support is one big thing. It's a big thing. It's support, and so there's there's many resources out there to help you, to help somebody, even somebody who's not struggling with drug and alcohol addiction, that somebody, a family member is struggling with drug and alcohol addiction. The family member, they have support groups and Al-Anon. There's other many family resources for family members to seek support and get them help also because it is a family disease. It's just not the individual that suffers, right? Everyone around them suffers also. I'm just saying off my experience, like I brought myself down and I brought my family and friends with me, so I caused a lot of harm and conflict in my relationships with my family, my friends, in the community, in the world around me, right? So, like, everyone suffered from me using drugs and alcohol. So it's a process to um, get the proper help that we need so we can stay on track. We got treatment options for drug addiction. Effective treatment for drug addiction often involves a combination of approaches tailored to individuals' unique needs and circumstances. Some of the most common types of treatment options for drug addiction include behavioral therapy. This is a type of therapy that helps individuals identify and change negative patterns of behavior that may have contributed to their substance use disorder. Examples of behavioral therapy, including cognitive behavioral therapy, CBT, and cognitive management system therapy. That's big. That's another thing that will help you through the process of your recovery is behavioral therapy. So I do see a therapist um, on like every month, every other month. Um, so there's things that we do in recovery to stay on track, and therapy is one of them. It says medication assisted treatment. Medications such as methadone, buprenorphine with opiate addiction. Other medications may be used to treat other types of substance use disorders. So certain medications, if we're coming off opiates and stuff, and like such as these medications can help us with the withdrawals and stuff like that. That a lot of times we're needed. Like if you're struggling with drug and alcohol addiction, you must get the proper help. You must get the proper help, and you get the seek professional help. So they can help you and guide you, and so you have experience long lasting recovery. You know, it says support groups. Support groups such as Alcoholics Anonymous, Narcotics Anonymous can provide individuals with a sense of community encouragement and accountability in their recovery journey. Yes, support groups is a major thing to have long lasting recovery, and I seek support groups. I choose to do a 12-step fellowship, as they say, Narcotics Anonymous, to help me, and it's not for everybody, but it's for me. So that's what we learn about in recovery. We have to find out what's good for us, and like what works for us, because everything doesn't work for everybody, So I choose to do certain things for my recovery to help me on a daily basis. Residential treatment, it says, inpatient or residential treatment programs provide individuals with 24-hour care and structured environment. These programs are often recommended for individuals who require intensive support or who have occurring mental health issues. It's important to remember that there are no one-size-fits-all approach to treating drug addiction. Effective treatment must be tailored to individuals' unique needs and circumstances. Seeking professional help is an important first step towards recovery. And it talks about seeking professional help is important. So that's what like I did when I first got in recovery. I went to treatment, I went to detox, I went to residential treatment, and like I stayed on the path of recovery. And I went to a support group and I went to a meeting as soon as I got out of treatment. And that's what was told to me, and I took guidance. I took direction and I listened because I wasn't willing to listen before. I always was talking and I knew everything, and like I wasn't willing to do anything but use drugs and alcohol. I wasn't willing to change. So there's things that we have to do to stay here in recovery. And like I took direction. I listened and I talked to other recovering addicts and I started working on myself and I started going to meetings and I started going to church and you know, saw professional help for my mental illness and like medications and stuff like that. I dove in. I had to not just do this or just do that. I had to start doing everything that was told to me. So we're going to end it there. That was our meeting for the day, and it was from consequences of drug abuse, physical, mental, and emotional effects. And I'm a recovery coach. My name is Carl, and I'll see you next time.